Hello all, this is Dr. Rupkumar. Welcome to another masterclass from Dentospedia. Today we're dealing with the ninth session of oral radiology, and today's topic is about dental anomalies. Okay, and the dental anomalies has been classified mainly into two. These are acquired dental anomalies and congenital or developmental anomalies. Okay, and the anomalies of dental origin has been divided into various kinds based on the etiology. Okay, if the number of teeth has been affected, there are certain kinds of anomalies. If the size is affected, we have microdontia and macrodontia. If there is any disruption in the eruption process, we will get transposition as a dental anomaly. And if there is any altered morphology, right, we will get these kinds of dental anomalies. Okay, and we will discuss each one by one. And coming to the acquired dental anomalies, we have certain kinds of uh, pathologies, or we can say disorders. They have different kinds of etiologies, and we will discuss each one by one. And coming to the introductory part, so congenital anomalies are those present at the birth, okay, and usually they are genetic origin, and sometimes they occur due to embryological disturbances. And developmental dental anomalies are those that occur during the formation and also morphogenesis of the teeth. So there is a subtle difference between congenital and developmental. Okay, and coming to the first dental anomaly, that is supernumerary teeth, and these are the synonyms of supernumerary teeth: hyperdontia, disturbances, mesodents, periodonts, parateeth, and supplemental teeth. And coming to the definition, there are the extra teeth present beyond the normal complement of teeth due to excess dental lamina, and they might be morphologically normal or abnormal. And supplemental teeth, when coming to the accurate definition, they're kind of an extra teeth, but they're having morphologically normal structure. Okay, and mesodents is a supernumerary tooth that is present in between the maxillary central incisors, and periodonts is a supernumerary tooth present in the premolar area, and disturbances is related to the third molar region. Okay, it is present distal to the third molars. And coming to the clinical features, it mainly affects Asians and Native Americans, and you can see it can affect both primary and permanent dentition. And these are the common sites. Okay, anterior maxilla for mesodents, and also maxillary molar region and premolar region for infused syndromic cases. Okay, and these are discovered radiographically in few cases. In few cases, these supernumerary teeth can be seen clinically. Okay, and these supernumerary teeth can pose certain problems like malocclusion, right, and also facial disfigurement. So all these can be treated with the help of orthodontics treatment. Okay, and there are certain syndromes where you can see multiple supernumerary teeth. They are clinocranial dysplasia, Gardner syndrome, and pignodystosis. And coming to the management, so most of the supernumerary teeth, they can be extracted without any problematic causing. Okay, and then we can go for fixed orthodontics if we need it. Okay, and we have to look out for certain dentigerous cysts. Usually, they're associated with impacted teeth, right? So we have to look out for these cysts, and if there are any cyst present, we have to clear the cyst, and then we have to go for orthodontic treatment. Okay, and you can see the mesodents present in the radiograph in between the two central incisors. Okay, and here you can see this is a CBCT of supernumerary teeth. Here you can see palatally present. Okay, in this OPG you can see the disturbances. It is present distal to the third molars. Okay, these are the distodents. And coming to the missing teeth, so synonyms are hypodontia, oligodontia, and anodontia. Okay, and they have certain differences. Okay, hypodontia is nothing but absence of one or few teeth. Oligodontia refers to absence of numerous teeth, and anodontia refers to absence of all the teeth. Okay, and what are the causes for these missing teeth? Usually, if there are any disturbances in the dental lamina, can result in missing teeth. Any failure of the tooth germ to develop at the optimal time, lack of space due to malformed jaws, okay, and any disproportion between tooth mass and jaw size. So these are the common causes. And coming to clinical features, and the most important points are the teeth, the commonly affected teeth. The third molars, second premolars, maxillary lateral incisors, and mandibular central incisors are commonly affected. Okay, and third molars are the first and most commonly affected. Okay, and the mandibular central incisors are least commonly affected. And you can see in the radiograph, you can see certain congenital missing teeth. Okay, and coming to the macrodontia, so teeth are larger than the normal. Okay, and it rarely affects the entire dentition. Usually, it is uh, limited to single tooth or few teeth. Okay, and there are certain conditions associated with macrodontia. They are hemangioma, hemihypertrophy of the face, and pituitary gigantism. So these are the conditions where you can see macrodontia as a part of a syndromic appearance. Okay, and coming to the clinical features, teeth appear larger in size, and because of size, we can expect crowding, malocclusion, and impaction of the teeth. And coming to the radiographic features, in the radiographs, you can see enlarged tooth size, right? And differential diagnosis, it can mimic gemination and fusion, okay, and often requires no treatment. So it is basically size enlargement, right? So unless it is vital and no problematic issues, okay, there is no treatment should be needed. Here you can see the molar increased in size, and here you can see the incisor, which is abnormally increased size. Okay. Coming to the microdontia, here the teeth are smaller than the normal. It may involve all teeth, or sometimes it may involve only few teeth. Okay. Commonly affected are lateral incisors and third molars. And common, situation where this kind of microdontia occur is pituitary dwarfism. It is a endocrinal disorder. Okay, and sometimes microdontia and supernumerary teeth, they kind of mimic each other, right? And coming to the clinical features, teeth appear noticeably small with altered morphology. Okay, and these are the this is how it presents. You can see mandibular molars having 4 cups instead of 5, and also you can see maxillary molars with 4 cusps instead of 3. So, and also peck-shaped laterals are common in these kind of situations. And coming to the radiographic features, you can see small teeth. The size of the teeth will be very small when compared to adjacent teeth. And you can see there are few conditions associated: congenital heart disease and progeria. And what is the management? Usually, no treatment needed if the tooth is vital. Sometimes, because of aesthetic purposes, we can go for artificial crowns, or we can go for extraction and then go for implants. Okay. Here you can see the microdontic tooth, right? Coming to the transposition, it is nothing but there will be exchange of positions of teeth in the dental arch. Commonly, permanent canine and first premolars are exchanging their positions. Okay, and rare thing is in between central and lateral incisors. Occasionally between second premolars and first and second molars. Okay, and it is commonly associated with hypodontia, supernumerary teeth. These are all kinds of disorders which commonly occur in groups. Okay, here you can see the canine and the premolar are exchanged in their position. Okay, that is called transposition. What is fusion? It is also called synodontia. So fusion is nothing but union of two adjacent tooth germs during development. And what are the possible mechanisms? Two germs develop too close to each other. Okay, they contact before classification, or sometimes any physical force or pressure during the development can cause this developmental anomaly. Okay, and coming to the clinical features, you can see reduce the tooth number, right? Clinically, because two teeth are fusing together, right? Two toothbuds are fusing together, so that's why you can get count of teeth one less than the normal. Okay, and most commonly affected is deciduous dentition. Okay, and most commonly, certain teeth are affected, right? For example, canine and lateral incisor fuse together to form certain kind of structure, right? And coming to the morphology, teeth may appear normal in size, but sometimes you can see enlarged tooth structure. Okay, and coming to the radiograph, usually you can diagnose it with clinical examination, and sometimes we can go for radiographic examination if needed. Okay, here you can see the mandibular central and lateral incisor has been fused with each other, giving appearance to a large tooth. Okay, coming to the congruence, it is nothing but fusion of roots of two or more teeth by cementum. So that's the key differentiating point. So what are the possible causes for this? Any space restriction during development, any local trauma, or any excessive occlusal force, local infection after development. Okay, and there are mainly two types of congruence: true and acquired. In true, it occurs during the development, but in acquired congruence, it occurs after development. So based on the development, based on the occurrence of fusion in the before or after the development, it is mainly divided into two types: true and acquired. Coming to the clinical features, usually this kind of congruence you can't see in clinical examination. Okay, because the tooth are attached by cementum, right? You can't see the apical portion, so that's why they are commonly observed in radiographs. Okay, accidental findings, and usually no treatment is needed unless it is complicated with caries. And very important sign is the absence of periodontal ligament space in between the roots. That's an important sign of fusion of two teeth by cementum. Okay, this is an important differentiating and characteristic feature. Okay, and you can expect this kind of an MCQ from this topic. And management, usually no treatment needed unless it is that those teeth are extracted. Okay, we might find difficulty during extracting these kind of teeth. Okay, so that's why we have to rely on radiographs, and then we have to explain the patient about the condition, and then we proceed for the treatment. Okay, here you can see the both teeth are attached to each other by the cementum. Coming to the gemination, it is also called twinning. Here, a single tooth bud is attempting to divide into two. Okay, it is quite opposite to the fusion. Partial division can result in crown invagination. Complete division can result in two structures, that is, separate tooth structures with crown and root. Okay, complete twinning can result in formation of two structures, that is normal tooth and supernumerary tooth in the arch. And because we are having an extra tooth, if we count those tooth, we will get one extra tooth, right? In fusion, we will get one tooth, one count less than the normal, right? But here we get one count extra. Okay, that's the main difference between gemination and fusion. Here you can see there is an invagination here, partial invagination, right? And coming to the taurodontism, so they have the tooth have elongated body and short roots. Okay, And pulp chamber is extending apically with the pulpal floor position lower than the normal. And it is seen in both permanent and primary dentitions. And most commonly, molars are affected. And we can't recognize this tooth with the help of clinical examination. So these are the accidental radiographic findings. Okay. Here you can see the tooth is elongated in morphology with narrow pulpal chamber, and also pulpal floor is directed apically than the normal. Okay, and also roots are kind of a short in nature. These are the characteristic features of taurodontic teeth. Okay, elongated root chamber, apically positioned furcation, short roots, and also crown dimensions remain normal. So that's why we can't identify taurodontic tooth in clinical examination. Okay, usually it is associated with Down syndrome, trisomy 21, and no treatment is required for this taurodontic tooth unless it is complicated by caries. Okay. Coming to another anomaly, that is dilaceration, where you can see sharp bend or curve in the crown or root portion. Okay, and it is kind of a developmental anomaly. And usually the radicular dilacerations are common when compared to the crown dilacerations. Okay, and this anomaly too is a accidental radiographic finding. Okay, we can't see the lacerated roots clinically, right? So during routine examination we can find this kind of dilacerated roots, and the main thing is, okay, and these are best detected radiographically, and most common teeth are affected are maxillary premolars. Okay, and the rest all the structures are normal, right? The PDL, the bone, all will be normal. And another important point is there will be an appearance called bullseye appearance. Okay, where you know the buccal and lingual bends, especially, not, I'm not talking about the mesial and distal bends, especially buccal and lingual bends. When we take an IOPA, they give an appearance called bullseye appearance. Okay, they have a central uh, radiolucency surrounded by radio opaque. Okay, and that appearance is called bullseye appearance. And coming to differential diagnosis, sometimes it can be confused with sclerosing osteitis. Okay, but we have to go for radiograph, and then we have to make the diagnosis. Okay, here you can see the root dilaceration. The most important point is this kind of dilaceration is significant during the extraction cases. Okay, we can we can have difficulty during extraction of these teeth because they're kind of an opposite to the our forces, right? We remove the tooth in buccal direction, right? It is because of this sharp bend we are not able to extract uh, normally with this technique. Okay, sometimes bone can be fractured, so that's why we have to assess the tooth and then we have to proceed the treatment. Okay, and then also we have to explain the patient about the condition and possible side effects. And this is about dilaceration. Here you can see the bullseye appearance. So any buccal or lingually dilacerated root will give this kind of appearance. Okay, I'm not talking about mesial or distal curvature. I'm talking about only buccal and lingual curvature. Okay, and coming to the another anomaly, that is dense invaginatus, dense indente, and dilated odontome. And the synonyms are distant odontome or tooth within a tooth. So the least severe form is dense invaginatus, moderate severely form is dense indente, and the most severe form is dilated odontome. Okay, it occurs mainly due to invagination or infolding of the enamel surface. So these are the main important types of dense invaginatus. Okay, and there are mainly two types according to the involvement: coronal type and radicular type. Okay, in coronal type only enamel lining is involved, But in radicular type, cementum lining is involved. Sometimes bone and pedal structures are involved. Here you can see there is invagination of the tooth structure. Okay, inverted teardrop appearance. Okay, here you can see this is the root portion where invagination has occurred. Okay, and also you can see inverted pear shaped. Okay, in the peg laterals. And come to another important anomaly that is called dense evaginatus. It is quite opposite to the dense invaginatus. Okay, it is also called Young's premolar. Okay, when dense evaginatus occurs in premolars, the tooth is called Leong's premolar. Okay, it is mainly occurred due to outpoaching of the enamel organ. Okay, and it is seen clinically as tubercle. Okay, it is covered by enamel, and usually premolars are affected. Okay, and this is about dense evaginatus. Coming to the amelogenesis imperfecta, it is a genetic anomaly mainly due to mutations in 4 different genes involved in enamel formation. Inheritance form is autosomal dominant, autosomal recessive, or X-linked. It affects enamel and all the teeth in both dentitions. Okay, and tooth are resistant to decay. So this is an important point. Okay, usually in amelogenesis imperfecta, teeth are very resistant to caries. Dentin root form is usually normal, so they are not affected. And there are mainly 4 clinical types: hypoplastic, hypomaturation, hypocalcified, and hypoplastic hypomaturation type. It is a combination form, okay, along with taurodontism. Here you can see the picket fence appearance. The teeth are kind of a, picket fence like structures, where you can see the hypoplastic enamel. Okay, there will be no enamel or less enamel present on the crowns, and they give appearance called picket fence appearance because the interproximal contacts are lost. Okay, here you can see the interproximal contacts has been lost, and they give appearance called picket fence appearance, and they're having thin enamel layer. Here you can see the proximal contacts are straight and thin enamel. And come to the another important anomaly, that is dentinogenesis imperfecta, also called hereditary opalescent dentin. This disorder mainly affects the dentin. Okay, and enamel may be thinner or normal in structure. And there are mainly 3 types: type 1, type 2, and type 3. And type 3 is also called Brandywine type. Okay, here you can see bulbous tooth structures, right? Bulbous crowns and constriction of the tooth at CEJ, and also reduced pulp chamber size and root canals. So these are the classical features of dentinogenesis imperfecta. Here you can see multiple bulbous tooth structures. Okay, and also there is an appearance called chisel tube appearance. Okay, which will be seen in this kind of dentinogenesis imperfecta. And also, and these crowns, these pulp chambers, they are called demillion shaped pulp chambers. Okay, coming to another anomaly, that is osteogenesis imperfecta. It is a hereditary disorder characterized by osseous fractures. There is an error occurring in the type 1 collagen genes. Okay, so that's why we are having brittle bones and multiple fractures. Okay, so bone contains an important collagen, that is type 1. So here type 1 is affected, right? So that's why bones are fragile and easy to fracture. Okay, it is an autosomal dominant trait. And what are the classical features? We have blue sclera. It is not exclusive to the osteogenesis imperfecta, but blue sclera can be seen in different kinds of disorders. It is not only the characteristic feature. Okay, and Wormian bones, they are nothing but small extra bones in the skull, usually in the posterior skull. skeletal deformities can be seen, and progressive osteopenia, so decreased the bone strength, right? Bone quality. As age grows, the bone quality will be decreased. Coming to the oral findings, sometimes class 3 can be seen, okay, and also impacted teeth can be seen. Here you can see the blue sclera, which is a common feature in this anomaly, and also you can see Wormian bones, small bones in the skull, usually in the posterior region. Coming to another anomaly, that is regional odontodysplasia, which is used synonymously with odontogenesis imperfecta, and there are certain teeth called ghost teeth in this anomaly. Okay, and it is a rare condition with hypoplastic and hypocalcified enamel and dentin, and it involves both primary and permanent. Okay, and coming to the clinical features, teeth are small and mottled brown. Okay, it is mainly due to the staining of hypoplastic and hypocalcified enamel, and they are highly susceptible to caries. So far we have discussed, right? Amelogenesis imperfecta has caries resistant tooth. Okay, this is an important MCQ, and here you can see multiple ghost teeth. Okay, coming to another anomaly, that is enamel pearl. It is also called enamel drops, enamel nodules, okay, enameloma. So these are the synonyms. So what are the characteristic features? You can see certain small globules of enamel on the tooth, okay, usually in the molars, in the furcation region. It is mainly occurred due to Hedwig's epithelial root sheath formation even before the loss of enamel, okay, enamel forming potential. And they are usually seen on the maxillary molars, medial and distal furcation, and sometimes mandibular molars, and they're typically asymptomatic. They are nothing but small nodules of enamel containing total enamel. Sometimes it might contain dentin or pulp horn. Okay, here you can see the clinical features. These are enamel pearls. So when it contains some pulp horns, we have to be very careful regarding root canal treatment. So that's why we have to go for X-rays, and then we have to confirm if there are any pulp horns present in the enamel pearl. Okay, we have to be very careful during the RCT of these teeth. Okay, here you can see the enamel pearls, and coming to the next anomaly, that is Turner's hypoplasia, also called Turner's tooth. It is basically local hypoplastic defect in the crown region of a permanent tooth. Okay, it is not affecting the primary teeth. Okay, what is the main cause? Any extension of periapical inflammation or infection from the primary teeth, and they are not getting treated, and that inflammation can cause this kind of defects in permanent tooth. Okay, if you're neglecting any periapical inflammation in the molar teeth, that is primary teeth, you can expect this kind of Turner's hypoplasia in permanent premolars. Okay, and also some theories suggest mechanical trauma can cause these kind of defects. Okay, and what is the important clinical features? They contain hypoplastic defect. Okay, they can pose as pitting and crown defects, and also there will be hypomineralization spots, brownish stain areas on the crown. So these are the clinical features. Here you can see the tooth crown has been deformed, okay, because of the hypoplastic nature. And come to the another anomaly, that is congenital syphilis. And what are the important characteristic features? They are Hutchinson's incisors and mulberry molars. Okay, Hutchinson's incisors, they're the incisors with screwdriver shaped crowns. Okay, because the major distal surface of the crown, they are tapered at the incisor area. That's why they are giving appearance of screwdriver shaper. screwdriver shaped. Okay, and those incisors are called Hutchinson's incisors. And mulberry molars, so the cusps, they're kind of a different when compared to the normal tooth. They're kind of a more globulated, and because of the globulated appearance, that molar teeth are called mulberry molars. Here you can see multiple globules on the enamel of the molars, and you can see the screwdriver shaped incisors. They're called Hutchinson's tooth, which is a characteristic feature of congenital syphilis. Here you can see there is the notching in the incisal area, giving appearance of screwdriver shaped. Okay, and that's the end of the session, and we'll meet again in the next masterclass of oral radiology. Thank you.